Suicide is the second most common cause of death in youths aged 10 to 24. According to Canadian Mental Health Association, suicide accounts for 24% of total deaths in Canadians aged 15 to 24. Out of 15,000 students from grades 7 to 12 in BC, 16% had personally considered suicide. 8 out of 10 people who commit suicide express or display their intentions prior to committing suicide.
Youth aged 10 to 19 are at high risk of suicide because they are transitioning into adulthood, face intense social pressures, are still learning how to cope with stress, and may have underlying mental health and interpersonal problems and conflicts.
We are the Vancouver Youth Association for Mental Health and Wellbeing, and we have designed a health promotion program called A.C.E, Vancouver Mental Health Initiative. A.C.E, which stands for Awareness, Collaboration, and Engagement. Our goal is to promote wellness and positive mental health through improving literacy and increasing education in order to prevent suicide among students aged 12 to 18 in the Greater Vancouver School District.
During our 10-month program, our main objectives are to increase overall mental health literacy by 50% among all students within each school, to decrease the amount of students who report feelings of loneliness by 80%, to increase mental health awareness by a minimum of 80%, to increase self-reported happiness by 50%, and of all these objectives will ultimately work towards completely preventing suicide among the schools we're working with. And now the question is, how are we going to achieve our objectives?
We have developed a 3-tier model. The first tier is awareness, which incorporates Mental Health First Aid Canada course. Our project will be able to fund one faculty member deemed the mental health advisor from each of the 18 public schools. The program teaches individuals the signs and symptoms of mental health problems. It also provides them the skills and initial help to provide knowledge necessary to guide a student towards appropriate professional help. The second tier is collaboration between faculty members and student liaisons. The mental health advisor will teach the liaisons based on the information learned through the mental health program training. These liaisons will participate through a volunteer basis and will be in charge of passing on that knowledge among fellow students. This tier will act as a bridge of communication between students. The third tier is engagement, which pulls all students together in participation. The liaisons will have the freedom to creatively plan and implement different outreach activities. With the guidance from mental health advisors and our support team, student packs will be formed during the first month of school. These student packs will be a small group of students in the same grade who will meet up once a month for student activities. These packs will help to foster a sense of belonging and unity by bridging ties between students who may not have connected otherwise.
In partnering with the Mental Health Commission of Canada, we will achieve our program objectives and goals. Through active and continued participation of students, our program will be sustained for many years to come. Knowledge will be conveyed through means of online communication, such as journal publications and databases.
How will we measure our objectives? They will be measured through 2 separate questionnaires. The 2 questionnaires will analyze mental health literacy, loneliness, mental health awareness, happiness, and suicide attempts among students.
As a result of our program, the projected outcomes are to increase awareness and understanding, improve knowledge and skills, engage within the school community, reduce stigma, increase mental health literacy, and work towards the ultimate goal of suicide prevention.
Our project sets us apart because many other suicide prevention programs use passive strategies, whereas our program actively seeks out youth at risk. We engage within the environment of our target population. Through unifying students into packs, we hope to create a better sense of belonging and allow students to actively engage with one another.